So really, I feel like I have so little to say at this point because everything has been said by all of you. And I just wanted to reflect on yesterday and thank you so much to the planning committee, to Jenny and Brooksann. And it was really kind of comical yesterday when Brooksann was standing up there trying to get us to say things that didn't work yesterday because everything worked, right? So thank you to the planning committee once again. And a couple of things that were mentioned yesterday are things that I'm going to talk about this morning. Ending homelessness, a vineyard, death penalty reform, being a teacher, Planned Parenthood, Broadway shows, and the learning community. Thank you for adding that. I believe we can end homelessness. I believe that we can end homelessness because I am a member of the National Healthcare for the Homeless Council, where we learn, we connect, and we advocate. On one of our recent board of director conference calls, we were talking about establishing an endowment for the council, and we had talked about how some of us are doing that within our own organizations, and talked about our discomfort at some point with that, building the buildings that we're building and establishing the endowments that we're establishing, and thinking about our organizations and their futures 10, 20, 30 years down the road. When many of us got into this business for temporary reasons, that we wanted to end homelessness and move on from there. When I give a presentation to community groups, one of the slides that I use, it's actually a slide that I inherited from my predecessor, Claire Goyer. It's an excerpt from a piece called The Worthy and Unworthy Homeless. It's from 1988 by a gentleman named James Wright. And it goes like this: at varying levels of analysis, homelessness is a housing problem, an employment problem, a demographic problem, a problem of social disaffiliation, a mental health problem, a substance abuse problem, a family violence problem, a problem created by cutbacks in social welfare spending, a problem resulting from the decay of the traditional nuclear family, and a problem intimately connected to the recent increase in persons living below the poverty level. So, kind of discouraging, really, when you think that. One of the things I'm fond of saying is that when somebody says, what's the answer to homelessness? And I say, well, homelessness is the end result of every social problem we have in this country. And to end homelessness, we have to figure that out. We have to end all of our social problems. So it's pretty discouraging, right? But I believe that we can end homelessness because we learn through the National Council, and we end homelessness within our own organizations and in our communities every day. At Duffy Health Center, we have a case manager whose name is Kathy Finn, and in addition to being an outstanding case manager, she's also a really wonderful writer. And every week, she goes around on Tuesday and she talks to the staff and she gathers stories from the staff, success stories, however incremental and baby step what those stories might be. She collects those stories and she puts them in an email that she puts out on Wednesday, and we call it Good News Wednesday. And it's incredibly uplifting to read through and see the work that's going on by our staff every day. And this is one of the stories from Good News Wednesday last week. I was working with a woman who contracted HIV a long time ago. One day while we were talking, she told me she wanted to go off her HIV meds. I was very concerned, but respected her choice, as she told me about the bad side effects and that her homeless life was too difficult as it was without the meds and their side effects. And she was just plain tired of life. She stopped being my client, but I followed her anyway. And about 6 months ago, I heard she was quite ill. Her HIV status was bad, and she was suffering from a lot of issues. When we talked about her at Huddle, the staff was very concerned and afraid for her life. At that point, she decided to seek treatment again. Dr. Klein sent her to Boston, to Tufts, to meet with our infectious disease contact. They got her on meds ASAP. In the meantime, Arlene, who was now working with her, was able to place her in a motel for a while with In From the Streets money so she could stay safe and as healthy as she could be. The streets are a very bad place for someone with a compromised immune system. Her treatment began and she began to feel better. At that time, Dr. Klein enrolled her in our hepatitis C program, as she had also been infected with hep C and was being treated for that as well, and that would improve her health. In the meantime, some housing money was cut loose, and Arlene worked with our patient to become housed. Not an easy process on Cape Cod these days. There was great news announced at the huddle the other day. Our Lady had no detectable virus for both HIV and hepatitis C, and she has been housed for the first time in 7 years. She ends by saying, "Hello, folks, we saved a life again. May it never get old." So did you hear in the message, there were some gaps in the story, but you heard trauma-informed care, probably some motivational interviewing thrown in there. You heard harm reduction. You heard housing first. Our staff, what distinguishes our case managers at Healthcare for the Homeless in our community is the professionalism of our staff and the fact that they're steeped in these evidence-based practices. It sets us apart from others. And a big part of that is the learning that goes on from the National Healthcare for the Homeless Council. And our staff and our organizations benefit from that. I believe we can end homelessness because I'm connected to each and every one of you. I like to call Healthcare for the Homeless the land of the misfit toys. Do you remember in Rudolph the Red-Nosed Reindeer, the island where the toys were? And they weren't broken toys, but they were toys that didn't quite do the right thing. In fact, in some cases, they did the exact opposite of the thing they were supposed to do. There was the Charlie in the box. Who wants a Charlie in the box? It's a Jack in the box. The cowboy that rode an ostrich instead of a horse, and the little choo-choo train with square wheels, so it couldn't really move. But together, they came together to defeat and actually convert the Sasquatch, remember? So I'm a misfit toy. Like you, like many of you, my career has taken some interesting twists and turns. As a young girl, I thought I wanted to be a teacher. Could you tell yesterday when I was getting us organized for Jim McRae, kind of officious I was. I thought I wanted to be a French teacher, and then I thought I wanted to be a PE teacher. I wanted to teach little kids in elementary school PE. So I went off to college to learn how to do that, and fortunately when I was a sophomore, I actually had the opportunity to teach little kids PE, and I was terrible at it. So great thing to learn, early on in my experience. But by then I had also participated and taken some community health education classes. And so I decided to switch my major, and really my passion became around women's health and reproductive health, and wanted to make sure that every young woman like I had was able to go to Planned Parenthood, because when your family doctor is your best friend's dad, that's not going to work, right? So graduated, moved up to Chicago along with all of my friends from school, from U of I, and my first job was providing continuing education, professional education programs for doctors and nurses. And through that experience, I learned that I loved working with doctors and nurses. I didn't want to be one, but I wanted to hang out with them and watch what they do and help support what they do. So I did some research on that, what could be my career, and there was no internet in those days, so I don't know how I researched that, but I found out about hospital administration, and so I decided to get off. I went to Ann Arbor, University of Michigan, to get my degree in hospital administration, and I went to a program that was embedded in a school of public health, as opposed to a program that was embedded in a business school, because it was really important to me to take the community perspective and really be all about addressing the health needs of people in the community, less so on the business side. And then when I graduated, I worked in a couple of really large medical centers. I worked at University of Michigan Medical Center, and I worked at Northwestern Memorial Hospital. So huge bureaucracies, and I loved it. I loved every minute of it. I love hospitals, A lot of people hate hospitals, but I love hospitals, from the basement to the, to the chapel on the 20th floor. I loved being part of a small cog in a big wheel, and I soaked it up. I tried to learn everything I could about how healthcare works and how large organizations work. But after a while, I sort of started to feel kind of like a fish out of water. It didn't really feel right to me. I couldn't wear the clothes I wanted to wear. I didn't know the right jokes to tell at the lunch table in the cafeteria. And everything was touched with this really kind of icky tinge of competition. It was a very competitive environment that felt increasingly uncomfortable to me. So as it often happens, the universe conspired, and I was flattened in an organizational restructuring. I was an assistant vice president. Everybody with a title that had assistant in front of it their position was eliminated. So fortunately, they treated me very kindly, and they allowed me to stay and work there while I looked for a new job. And I will never forget the day when I was sitting in the outplacement office and I was looking through the Chicago Tribune to look for a new job, which is what we used to do in the old days. Before the internet, we looked for jobs in the paper. And I saw this teeny tiny little ad that said, "Help wanted, executive director for a clinic serving the homeless." And so I put in my resume, I got the job, I met my beloved mentor and boss, Sid Moan, and there I was in healthcare for the homeless. And really, I felt like it fit me like a glove. I love healthcare. I love the science of healthcare. I love the business of healthcare. But I also love making it work for the people who are left out in our country. Through Healthcare for the Homeless, I have met Ed Stellan. 24 years ago, Heidi Romans met 24 years ago, Ed Stellan. When I left Heartland Health Outreach 6 years ago, we had 250 employees, and there were 5 that had been there longer than I had, and Ed was one of them. And when I started at Heartland, Ed was an outreach worker and did substance abuse groups. So he took me on outreach with him, and we went to Goose Island. I know you all think that Goose Island is a beer, but really it's an icky place in Chicago where homeless people camp. And we went there, and I learned the value of giving somebody a pair of socks or some underwear, and how a simple act like that can establish a relationship. Ed took me to the church basement where the Lakeview shelter was, and I got to watch him lead a substance abuse treatment group. And it was just so striking to me, these 8 to 10 men who were sitting there just completely lost in their lives and lost in their addiction and wanting to figure out what to do, and responding to the simple act of this lovely man coming to sit in the midst of them and reach out to them and offer help. Through Healthcare for the Homeless, I met Marianne Savarese and Barbara Kananen, great Healthcare for the Homeless nurses. And I learned that no matter how bad homelessness is in your community, it's worse in New York City. It's a tragedy, a human tragedy, and people coming at you day after day after day. And it's one of the things that we talked about, productivity in the shelter setting. And I even invited Marianne to come to Heartland to meet with our nursing staff and our staff to talk about how can we retool what we're doing so we can see as many people as possible, because the need was just really overwhelming. I met Susan Nybacher. One of our very first conferences at the Capitol Hilton, she came up to me at break time and she said, "Hi, I'm Susan from New York. Are you the new girl from Chicago?" I adored Susan. I will never forget her, and her lesson to me was to speak loudly and carry a big stick. That was the Susan Nybacher lesson. I met Jim O'Connell and Bob Taub from Boston Healthcare for the Homeless. When you run a large, complex Healthcare for the Homeless program, you kind of have to reach out to those others that have programs like yours. And when I was interviewing for my job at Duffy Health Center, I called Bob, and Jim were kind enough to get on a conference call with me because I wanted to know what it was like. I needed to know some inside information about Massachusetts. And I learned that in Massachusetts, people who are homeless can get therapy because they're depressed because they're homeless. And we didn't have anything like that in Illinois. And I thought, man, I got to go there. I want to work there. I want to be in Massachusetts. I met Vince Keene, who encouraged me. Do you know that Vince's program in DC runs the correctional healthcare system in the jail in DC? And so he taught me to think big about working with the criminal justice system. I met Karen Rotundo and Jean Hochran, and many, many wonderful healthcare for the homeless women who taught me how to laugh when I really felt like crying. I met Barry Bach, my new colleague from Boston Healthcare for the Homeless. Barry told me a couple of years ago that at Boston Healthcare for the Homeless, they pay a higher percent of the premium share for their lower paid staff, for their health insurance. And so I filed that in the back of my thinking, and this year, and that was at the insistence of the higher paid staff, by the way, that was their idea. And so I filed that in the back of my head, and in FY17, we pay at Duffy Health Center, we pay a higher premium share for the employees who make less than $50,000 a year. I met my friend Kevin Lindemuth from the Baltimore program, and I was on a call bragging about how also in FY17 we are going to have nobody makes less than $15 an hour at Duffy Health Center. If you're permanent and full-time, nobody makes less than $15 an hour. And Kevin, of course, said, well, we're paying the housing wage. And I'm like, So I went on the computer and I looked it up, and the housing wage for Barnstable County is $18.69, and I'm like, oh my God, I still have more work to do. I met my friend Jenny Metzler. You guys, if you are ever going to start an art program at your health center, don't let your board member call Jenny to find out about Art Street. Because that's what happened to me at Duffy Health Center. And now nothing that we do is going to be good enough because it's not Art Street. You got to learn about Art Street. I met Frances Isbell and John Parvensky, the queen and king of permanent supportive housing for chronically homeless. You inspire us every day. And now my cohort in Massachusetts, Nick, Larry, Doreen, and Brian, and Barry, my Massachusetts homies. I don't know what I would do without you. All of these misfit toys I met through the council, and they taught me so much about the people that we serve. I believe we can end homelessness because we have fierce but gentle leadership that fights for the people that we serve. I met John Lozier for the first time when I was sitting in my dingy little office at Heartland Health Outreach, my first office with the white marked up walls and the fluorescent light and the metal desk that had been in some hospital 50 years ago. And just trying to figure out what the heck I was doing on my first day. And at 3 o'clock in the afternoon, my telephone rang, which that in the old days, that's how we talked to each other, right? And the phone rang, and I picked up the phone, and it was John Lozier, who was welcoming me to the National Healthcare for the Homeless Council. So a couple of things you might not know about John. How many of you started out your misfit toy career in seminary or in religious life of some sort? Yeah. So that's part of John's story. But another really interesting part of John's story is that early in his career, his passion was advocacy around the death penalty and abolishing the death penalty. Excuse me. Marco Rubio. I thought, when I was researching, preparing this talk, I thought, that's going to be a really good news story. I'm going to look up about the death penalty because we've come so far. We've come so far in the past 40 years around the death penalty, and I was shocked to learn that we really haven't. In 1977, there were 10 states in the United States that had abolished the death penalty. Today, there are 20, just 20. And there are 4 additional that have moratoriums against the death penalty, but still, Slightly less than half of the states in this country have abolished the death penalty. And worse yet, in 1977, the federal government reinstated a federal death penalty that had been off the books for decades, reestablished the federal death penalty, and today we have 500 people on death row in federal prisons awaiting execution. It's an unbelievably heinous policy, and I thought I was going to be able to say, congratulations, you don't have to worry about it anymore, but maybe you need to get back to work, right? Working on that. So, but what I want to say also that John has, as for all of us, John has been such a huge influence on me, a calming, peaceful influence. When early on in the 20s, in the 90s, I was in my 20s, I wasn't. I was in leadership in the council. And as somebody said yesterday and today, at the time, the council was a club. It was made up of the 20 to 25 projects that were part of the original Robert Wood Johnson demonstration, and that was the council. And it was just starting to get really awkward because the Bureau was funding more and more healthcare for the homeless programs, and people would come and knock on the door and say, "Can I join your club?" And we'd have to say, "No, you can't join our club." So this became untenable, and at some point, as leaders, we decided that we needed to expand our understanding of the National Healthcare for the Homeless Council. But being a leader at that time, I was frozen. I have to say, I was frozen in the face of the opposition, the emotion, the opinions. I really didn't know what to do. And John really led us through that time, thinking about what are ways that we can change our thinking and change our structure in a way that won't be threatening, that we won't lose this wonderful thing that we have together, but we can open the door and let more people in. And so the first step that we took was to expand the board. Well, let's just make the table bigger. We have these 25 old farts can sit around the table, but we're going to bring clinicians in, and we're going to bring consumers in, and nobody can argue with that, right? And so over time, we became a membership organization that anybody could join, and the board eventually evolved into the board that it is today, because there were always people who were on the council who didn't participate. They were easy to replace, and we just kind of went from there. So John Lozier, fierce in fighting homelessness, but gentle in the face of human nature. I wonder if any of you have seen the Broadway show Hamilton, or listened to the music on YouTube. It's very easy to access. One of my favorite scenes from Hamilton is where George Washington tells Alexander Hamilton that he's not going to run for president for a third term. And it goes something like this. Hamilton: "Mr. President, you asked to see me." Washington: "I need a favor. I need you to draft an address. I'm stepping down. I'm not running for president." Hamilton: "I'm sorry, what? As far as the people are concerned, you have to serve. You could continue to serve." Washington: "No, one last time, the people will hear from me. One last time. And if we get this right, we're going to teach them how to say goodbye. You and I." Hamilton: "Mr. President, your position is so unique." Washington: "So I'll use it to move them along." Hamilton: "Why do you have to say goodbye?" Washington: "If I say goodbye, the nation learns to move on. It outlives me when I'm gone. Like the scripture says, everyone shall sit under their own vine and fig tree, and no one shall make them afraid. They'll be safe in the nation we've made. I want to sit under my own vine and fig tree, a moment alone in the shade, at home in this nation we've made." One last time. The vine and the fig tree is a symbol that George Washington used over 50 times in his writing and his speaking. It was his image taken from the prophet Micah of living in a land of peace, back on the farm in peace. The prophet Micah used it to describe the nation of Israel. Micah was also the one who talked about beating swords into plowshares and spears into pruning hooks. And Micah was also the prophet who admonished us to do justice, love mercy, and walk humbly with our God. Living in peace under the vine and the fig tree. We have to let John go. Back to the farm. But what does that mean for the National Healthcare for the Homeless Council? Well, I have to tell you that I have great hope for our organization. I just heard the Quaker theologian Parker Palmer on a radio show talk about hope. And he talked about hope in the context of being a rebellious act. In these days, in our society, hope is an act of rebellion. And he read a poem that goes something like this. Our mission is to plant ourselves at the gate of hope, not the prudent gate of optimism, which is somewhat narrower, not the stalwart, boring gates of common sense, nor the strident gates of self-righteousness, which creak on shrill and angry hinges, nor the cheerful garden gate of everything's going to be all right, but a different, sometimes lonely place, the place of truth-telling, about your own soul first and its condition, the place of resistance and defiance, the piece of ground from which you see the world, both as it is and as it could be, as it will be, the place from which you glimpse not only struggle, but the joy of struggle. And we stand there, all of us, beckoning and calling, telling people what we see and asking people what they see. All of us correspond with John, and we know that he doesn't end his correspondence with something like yours truly, or cheerio, or have a great day. John ends his message always with one simple word, which is how I will end today, and that word is peace. Thank you.